Hi, this is Ian here, and in this tutorial we're going to be looking at how you can share your idea or your practice in immunisation through the Ideas Engine. So we're assuming that you can log in to the Ideas Engine. If you haven't got that far yet, you may need to go back and look at the tutorials either to join the Ideas Engine for the first time or to rejoin the Ideas Engine if you have previously used the Ideas Engine as part of the COVID-19 Peer Hub. So the key things we're going to cover here: what should I be sharing in the Ideas Engine, what an idea is, what a practice is, how you do that, so how to navigate the Ideas Engine to do that, and then some tips really for how can I make my idea or my practice interesting and something that other people want to read and get useful inspiration and learning from. So when you log into the Ideas Engine, you'll be faced by this screen. This is the home page, and you reach it through this home icon in the top left hand corner of the screen. So if we scroll down this, we see 2 bullet points here, and this is the essence of what we're asking you to do in this exercise. This is that you think of one thing that you do that makes immunisation work better. And we're calling that a practice. So this is something that you do or you have seen other people do firsthand. Or we're asking you to share an idea. An idea is something that you think could make immunisation better, but you haven't seen it put into practice yet. And what we're asking you to do is take some time to think of, what do I have that I could share, whether it's an idea or a practice. You may have an idea that's going to transform immunisation. That's fantastic. But you may also have something that you do that makes a difference, that's slightly different to what everyone else does, but in your experience, this makes the world of immunisation work better. Both of these are of interest. The Ideas Engine is about both of these. So if we scroll down, we will see that we have organised the ideas and practices according to the IA 2030 strategic priority areas. So if you're not familiar with these, that's not an issue, but what we'll ask you to do is to decide where your idea or practice best fits. Is it about commitment and demand? Is it about immunisation programmes for primary health care and universal health coverage? So if you're not sure, what you can do, and you can do for all of these to submit an idea or a practice, if you click on the text here, SP1 immunisation programmes, it will take you through to a page which includes the key areas of focus that are included under each of the strategic priority areas. In the case of SP1, we're talking about immunisation in primary healthcare, leadership, governance and management, health workforce. So if your idea or your practice is about leadership or it's about the health workforce, you should be adding it to strategic priority 1. Now, to add the idea, so you've got this black box at the top with the plus, add idea. Click on that, and it takes you through to a form where you'll be asked a number of questions, and that will provide the text that other people can look at. You have the opportunity, if you have a picture or an image through this banner image, card image at the top, you have the opportunity to upload a nice picture, and this will be visible to everyone. So one way of making what you say attractive. What we have found in the past is that the title that you add is really important. If you can make a specific title that explains in a few words what it is you're about, it's much more likely that other people will read it, because they will be able to see very rapidly what is this about. And what we're asking you to do is to imagine that you are sat with a colleague from another country, so they don't necessarily know your context. So you're going to have to explain a bit about, where is it I work? Is it in a rural setting? Is it in an urban setting? What is my role? And then you will need to respond to the questions below and give as much detail as you can so that your colleague can understand what it is you're proposing or what it is that you are already doing. So the first question, and you'll notice that some of these have a star with required next to them. You will not be able to complete the exercise unless you answer each of these questions. So you need to give a title, you need to give the language. Is what you are doing describing based on your experience? So this is the key question. So is this an idea that you have, or is this something that's an existing practice? And you see there are two responses here, and these change the questions slightly that you'll be asked as we go through. So this is something I've already done. And here we're being asked to describe what is it you have been doing, who is doing what, where and when. And you'll notice that there are 5,000. There's a character limit here. This isn't words, this is characters. So as I type in characters, you'll see that the number of characters goes down. Next question. How are you measuring implementation of your practice? What have been the results so far? So if you have some data from implementing this practice, this would be a great place to share them if you can. At what level of the health system is this being implemented? Is it your personal practice? Is it something that goes on in your health facility but not in your district? So give us a sense of, where does this happen? Are your actions included in Ministry of Health plans at your level? That's a yes, a straight yes or no. And what have you learned from doing this? What is it that it might be useful or interesting for your peers in other countries to learn from your experience? How does your idea or practice relate to COVID-19? Nothing has to be related to COVID-19, but it's helpful when we come to people looking for ideas and practices to be able to categorize in this way. And then the key areas of focus. So each strategic priority has key areas of focus, say health workforce. So you then have the opportunity, if you can, you have the opportunity by using this plus sign at the bottom with attachments to, either upload a file, so it will take an image files, it will take document or a PDF. So if you have a plan or a micro plan that you can share, please do so. And you also have the opportunity, if you, in case you have a short video or something on a YouTube channel, you can upload the URL here, and this will also be available to everyone. This is not a requirement. When you have completed all of the sections, you will be able to save your work either as a draft if you want to come back to work for it later, or you can publish it. At that point, what you have shared is available to everyone. You have the opportunity here to share your idea directly with other people. That's absolutely fine if you have a colleague you'd like to share it with. Otherwise, you can continue without sharing. And when we look at here in the SP1 space, we see that the first of the ideas is now visible. Thank you.